We start with health care reform and the abortion challenge. U.S. Congressman Jim Cooper is a Democrat from Tennessee. Thank you for joining us on this day off for the world.
Good to be with you.
Congratulations as a Democrat for getting health care through, but there was a price. You got 40 Democrats to vote for an amendment which basically took abortion coverage out of this program in order to get the bill passed. I'm told by one of your colleagues, Diana DeGette, is it? That she has 40 Democrats on the pro-choice side ready to vote down the bill if it comes back from conference with this provision in it. How do you cut this deal that saves health care?
Well, first of all, Chris, as you know, it was a very historic night. The most important issue is to get health care to all Americans, men, women, children, everybody. This was a surprise sort of last-minute amendment. A lot of folks were confused about the best way to preserve the status quo, the so-called Hyde Amendment that has prevented direct taxpayer subsidy of abortion. This is a new health reform plan, and a lot of folks don't quite understand it yet. And the Stupak Amendment was really aimed at the exchange. And the exchange would really only affect 10% of the American people, about 30 million people, and that's a lot. And these would tend to be your lower income folks, vulnerable, but not the poorest of the poor who are already on Medicaid. So the question is, how would the restriction on direct taxpayer subsidies affect the folks in that exchange? And this is something that we're still working out. The bottom line is this. The House bill will be substantially changed in the Senate. In fact, it may bear little or no resemblance to the House bill. That will be good news for a lot of choice folks on this issue. Will all be determined by the senators, though. And as you point out, it could make the House passage of the bill look easy to try to get something through the Senate with 60 votes.
Well, not to be stubborn, but watching everything that happened Friday night or Saturday night, I was not impressed or surprised like you were, because I could see this coming. I kept watching and watching and watching this abortion juggernaut grow and grow and grow. There were 40 Democrats who voted for that amendment and then voted for passage. I can only assume Nancy Pelosi, being as sharp as she is, did what she had to do. She needed those 40, right?
Exactly.
What happens if you lose them on final?
Well,
those pro-life Democrats, they may be inconvenient to the larger Democratic Party, but they exist.
You're exactly right. You're Catholic, you understand. This used to be the core constituency for the Democratic Party. The key is helping people understand exactly what the Hyde Amendment does. It's been law since 1977. Most people are pretty satisfied with that compromise. It's not fair, it's not easy, but that only affected direct taxpayer subsidy for abortion. Now, with the new health reform, it's a lot more complex plan. It has a lot of indirect subsidies for various things in health care. So the question is, how do you get a complete health benefits package for men and women that would include choice and services?
Well,
like
you tell me this over. You keep repeating the problem. What's the solution? There are, by the way, people who support abortion rights because they believe ultimately the woman has to make up the decision. After all the deliberation and counsel and advice and everything, in the end, that person in a free society, there's some people who hold that view, who also believe the federal government shouldn't be subsidizing abortion. I think Joe Biden, by the way, Vice President Biden, is one of those who would not support funding, but supports the right. Now, that may be too complicated for some people, but for me, it's easy to understand. You let a person make a decision you don't agree with, but you don't help them make that decision.
Exactly.
Okay?
It's a free country. You can spend your own money on whatever you want to.
Don't ask me to help.
The question is taxpayer subsidy.
That's the way a lot of people look at these things.
Yeah, exactly.
So what do you do with those people? How do you pass a bill that takes these 40 people, or some of them at least? You're going to need this to pass the bill. How do you deal with it? Well,
the Speaker was very artful getting the bill through Congress. It was a tough thing to get 220 votes. We nearly didn't get to 218. Right. They had to pull out all the stops, and this was one of them. I think as members calm down, as members look at this carefully, one of the problems was the Rules Committee itself reported out language that said that the Stupak Amendment codified the Hyde Amendment. That was not accurate, and it went beyond the Hyde Amendment.
Explain how.
Well, by affecting not only direct but indirect taxpayer subsidies. The Hyde Amendment has never affected indirect taxpayer subsidies. For example, the second largest health program in America is a tax break for folks with employer-sponsored coverage. Anybody who works for a private company gets some help from his fellow taxpayers to afford that coverage from the private employer. It's not obvious. It doesn't look like a government program, but it is, and it's $250 billion a year. The Hyde Amendment has never applied to that.
Right.
It should not apply to that.
The problem with this is that it fits in the middle. It's a subsidy.
For the 10% of the folks in America who are allowed to shop in the exchange, and I actually think more people should be allowed to shop in the exchange, it's essentially acting like a federal employee. You know, federal employees have been able to shop from an annual menu for a long time. It works great. It works in all the states. It's worked for 30 or 40 years. Democrats and Republicans love it. We need a program like that so that all Americans can shop for health benefits in a sensible way. We can do that.
Okay, thank you very much.
Thank you, Chris.
Thank you for coming over, Congressman Jim Cooper of Tennessee. Let's bring it now to